welcome to Daily Debrief brought to you by People's Dispatch. I'm Pragya. Tuberculosis is still among the world's most lethal killers. Infections rose to 10.6 million cases in 2021. That's what the WHO's annual report on the illness finds. Voter intimidation in Arizona and other states is a serious and growing concern as midterms loom in the United States. We discuss these developments and a bridge that collapsed in India's Gujarat, killing at least 130 people. What could have triggered this tragedy? Find out in Daily Debrief today. The world is far from putting the tuberculosis epidemic behind it, finds a detailed World Health Organization report covering 215 regions and 194 member states. It's still among the top infectious killers as countries erased years of progress in tackling the illness. Tuberculosis requires prevention and cure through multiple healthcare and nutrition interventions. We talked to Jyotsna from People's Health Movement about the findings and the report. Jyotsna, thank you for joining us. Very grave report from the WHO, a very widespread study they have conducted of tuberculosis, and we haven't put the demon behind us. What are the report's findings exactly?
Yeah, hello. Yeah, so thanks for calling me for the show. That is true. The Global TB report, it is an annual report that is produced by the WHO, and therefore everybody who works in the TB field waits for it. And again, the data, the findings are quite damning, the way it was last year. So last year, the 2021 report itself had shown us how the TB treatment, prevention, and diagnostics and research and innovation, everything in the TB field had derailed in 2020 with the onset of the COVID pandemic, right? And the unfortunate part is that we have not been able to overcome it even now. So the report shows a little increase in TB notification compared to 2020, which means that the number of people who the governments across the world have identified who have TB, that is what is called notification. So we saw a sharp decline of these reported cases in 2020, which was really sad, which meant that people were not coming to the health facilities to seek TB treatment. And governments were not able to do active case finding also, which happens by going to the people who are at the high risk, and you go and test them and find out whether they have TB or not. So all of these services were badly derailed, and we knew that will happen in 2020, which the report showed. But this year, again, we are seeing the situation has improved very partially. It is not a great improvement, which means that it's been 2 years since we have not really gotten back on track as far as TB treatment and other aspects is concerned. So that is really bad. Also, unfortunate part is that the number of TB deaths have also increased from 2019 to 2020 to 2021 also. And it was obvious that because if people were not coming for treatment or in time, then the deaths had to increase, and that's what the report shows. So this is the other quite damning feature.
So Jyotsna, just to interrupt you, now the 10.6 million cases that are reported this time, which are higher by about 3.4% than the previous reported cases in 2019. This uptick in the reported cases is actually a positive sign because it shows that the health systems are coming back into action.
So that is true. When we talk about TB notification, we always want to go as close as possible to the estimates that the WHO and other agencies have. But at the same time, we are still missing a lot of people. And the problem is that we were seeing the trend. Yeah. So also the other thing is what we need to understand, that the governments are going to tell us that it is because of the COVID that the derailment has happened. But we need to be very cautious about it. Is that entirely true? Of course, COVID impacted, but that is also because the entire structure of which used to cater to TB services was shifted to COVID, because both are, at the end of the day, are infectious diseases, and a big part is lung disease when it comes to tuberculosis. So you shifted that entire thing to COVID without caring for what will happen to the TB people affected by TB. And even after 2 years, you have not really replenished the whole TB system, and you continue to just work towards COVID more. So that is one problem. So yes, that happened. But unfortunately, if we see even before that, even before COVID hit, it is not that the WHO or the others were on track. And I'll just give you some data which this particular report shows. So WHO itself says that their target for till 2025 is that they would have liked to reduce number of TB cases or people affected by TB by 50% till 2025 from
Right.
2015. So in 10 years, where are they right now? The reduction is only 10%. This is not only because of COVID. I mean, even by 2019, they were not doing great about it. Then the number of TB deaths they wanted to reduce by 75%. Only 5.9% deaths have been reduced in the past 7-8 years. What are we expecting? Are we expecting some miracle to happen in the next 4 years? Then similarly, people should not be spending on TB. That has always been the understanding. So zero people should spend on TB, or zero people should have catastrophic event. I mean, catastrophic expenditure on TB, something which can, shift them from above poverty line to below poverty line. But only 48%. COVID could make things worse, but we were not really in a very good state earlier. And there is a reason for that. So look at the data as far as funding is concerned for TB. So it has always been expected that will have to spend US $13 million annually to actually meet the targets that the WHO had set. 13 billion annually. We have only been able to raise 5.4 billion in all, in total.
So not when half the required budget has been raised.
It's not.
So Jyotsna, just to conclude, whose responsibility is it to fund this kind of a project?
I think it is obviously the domestic funding has to increase, but the answer is not that simple. TB is not to be seen in isolation in itself. It is a disease of the poor, as we all know, because the undernutrition, malnutrition is something that really ensures that somebody, even with very mild infection, gets a bad TB. The drug resistant TB is something which is spreading like wildfire in a lot of parts of the world. And all of this is related to poverty and malnutrition. So, till you really do not have your social policies which can work towards that, you will not be able to really handle TB. So, none of these things should be social determinants of health, as we keep talking about. TB is one of the diseases most closely related to that. So you have to work on social security measures. You have to ensure that your people eat food and good food. You need to ensure sanitation. You need to ensure proper housing. And unless you do all of that, you cannot get rid of TB in a silo. And so that is one thing that the governments have to do. The Global Hunger Report recently released shows that hunger and starvation has increased. It's going to impact TB. So maybe it requires that kind of a comprehensive vision, and only that can ensure that we really overcome something like TB, which is the number one infectious disease killer in the world.
Right, Jyotsna. Thank you very much for that information. As the United States gears for midterm elections next week, a lawsuit against voter intimidation is gaining national attention. On Monday, the Justice Department in the Joe Biden administration supported a lawsuit filed by voting rights activists in Arizona. So-called ballot security groups formed by right-wing and vigilantes who favor former President Donald Trump have reportedly spread disinformation through campaigns at ballot drop boxes meant for early voters. Let's go over to Anish from People's Dispatch, who has been following this story. Anish, thanks. Good to have you back on the show. Anish, who are the ballot watchers and what is this case all about?
Well, the case is a group of retiree and female voters and civil rights activists who have been going against, or at least trying to go against this right-wing set of groups who are calling themselves ballot watchers or ballot security groups or whatever. The whole point is that they hover around ballot drop boxes. Now, ballot drop boxes, for those who do not know, or for those outside who do not understand how things work in the US, are drop boxes where you can submit your early ballots. Mostly, it's a thing that is available for senior citizen, people who may not be able to vote from their own home state because of various reasons, and unavoidable reasons, and stuff like that. So you can actually put them in drop boxes that are designated by the state government in designated areas under obviously state supervision. So it's not like just a drop box is left alone. But these people are there hovering around drop boxes. Often, some of them have used tactics that have included videographing voters and including ballot collectors. Now, ballot collectors are a different thing as well, which is at the heart of this conspiracy theory that they're trying to make, who are being called as ballot mules by the right-wing groups and pro-Trump Republicans. Basically, ballot collectors are people who collect postal ballots and absentee votes from voters who are not able to physically submit their votes and do it. These are designated people as well. They are part of the state administration in some way or the other. Sometimes they are just volunteers as well. But these are legal methods of submitting your votes. There are ways to vet these votes as well to consider whether or not they're valid or invalid. There are systems in place, but conspiracy theorists have often used these factors, these mechanisms that have existed much before even Trump got elected, as proof of vote manipulation. And this is something where they have used a number of tactics, which includes from, as I said, videographing voters and ballot collectors to even going going near ballot drop boxes with arms, with open carry arms. And so, which pretty much does the work of intimidating possible voters, potential voters, early voters who constituted in the last election a significant chunk of the votes, and that often also affects results.
Right, Anish. Anish, now, what does this have? Does this have any connection with the midterms that are due? What is really going on?
I mean, definitely it has, with midterms coming in, this whole point of this whole conspiracy theory of ballots being stolen or ballots being stuffed or vote manipulation is now finding new life. We've seen that happen in the 2020 general election when President Biden was elected. And we've seen how violent it can be at times. There were places in Georgia where vote counters were intimidated, people who were counting the votes on the counting day itself. And there were even possible attacks. There was almost riots in many places. Police had to be deployed in many places just to protect these ballot collection centers and voting centers and so on. So you can I imagine if in places like these, in situations like these, where they are allowed to intimidate, or if not intimidate exactly, in many cases, they are just making outright false statements to voters, to potential voters, which can be illegal in many places, but we need the courts to weigh in on that matter. But these factors often can affect how the outcome of the vote happens. You have to remember that a large number of people who make use of early voting procedures and mechanisms are people who come from very disadvantaged families, working class families, racial minorities, even elderly who are more likely to not vote for Republican in many places, at least. It may not be the case with the elderly, but in other cases, definitely that is where there is a distinct tilt toward Democrats. So this entire attempt is to manipulate the results of the elections in the end of the day. And this is something that really needs attention. Obviously, it is getting attention now because the Justice Department is weighing in on the matter. But if the courts do not crack down on these matters, this is going to have a long-term impact, and not just for the midterm polls, but also for the next general elections in 2024.
Right, Anish. Thanks a lot for joining us with that update. Tragedy in India as a 135-year-old suspension bridge recently under repair collapsed on Sunday evening. At least 134 died when suddenly plunged into the river below. The incident occurred in Morbi town, not far from the capital of prosperous Gujarat, the home state of Prime Minister Narendra Modi. His party called it an act of God. With hundreds missing or unaccounted for and authorities questioning those who repaired and managed the structure, questions have arisen also about safety norms being ignored. We spoke to Prabir Purkasa, editor, NewsClick, about this issue. Prabir, thanks for joining us today. Prabir, tragedy in Gujarat. Now, what could be the possible causes of the collapse of a bridge of this nature?
Well, this is a very specific bridge because these are what are called suspension bridges. That means they're really hanging attached to certain cables. And of course, the difference between a hanging bridge and a supported bridge is normally there'll be a number of pillars or piers on which the bridge rests. So the bridge as a whole is not supported by any pier, but each section of the bridge is supported by a set of piers. In this particular case, if the bridge is a hanging bridge, then the integrity of the entire bridge is what provides the safety of the bridge. So if any section is damaged or if any section breaks, the whole bridge is going to collapse into the river. And that's exactly what happened here. So suspension bridges by their very nature have larger safety considerations, and obviously when you look at such bridges, the consideration of safety is paramount, because as I said, that it's not a question of a damage to the bridge, but if any integrity failure takes place in a section of the bridge, the whole bridge is going to collapse, unlike other bridges.
Okay.
So therefore, I think what is important here is to note that this is an old bridge. This has been there for more than 100 years. Therefore, when it was being renovated or repaired, how much consideration is given to safety of the bridge, and whether the steps to see that the renovated bridge, what is the capacity of the bridge, where this is taken into consideration at all. That, I think, is a key question which has to be answered by the government, state government of Gujarat in this particular case, and of course the municipal authority, who seem to have sanctioned the renovation to be given to a private party who has no experience of such work, and what is the supervision they asserted over the bridge.
So, Prabir, the question naturally would arise of responsibility, especially in a tragedy of this scale. Now, Gujarat is a prosperous state. It is heading for elections. Will all these considerations play on the mind of the government when they respond to this tragedy?
See, when any tragedy of this nature occurs, the government generally, all governments, have a reflex action to deny their responsibility and say they will take very strong action against the perpetrators, meaning that we are not the perpetrators of this accident. It is the responsibility of somebody else's. In this case also, we find almost the same thing, that the people of these two companies which are supposed to be involved, one who got the contract for the repair of the bridge and the other who actually carried out the contract, that some of their people have been put behind bars right now. FIRs have been filed. But of course, the senior personnel don't seem to be affected by that as yet. But as the pressure mounts, maybe they will also get charges against them. But the point is, the responsibility does not end with the company who executed the contract, because we have looked at the contract and it doesn't seem to mention safety or the regulatory role of the state in the bridge. So the primary question for us to ask as citizens is, when an accident of this nature occurs, we have to take for granted it's the state's responsibility to protect the citizens, and giving a commercial contract for repair of the bridge in lieu of the toll they could charge on the people using the bridge does not absolve the government or the municipal authorities of the responsibility to ensure the safety of the citizen. And that is the question which is being asked, that if a contract of this nature was given, in this case it was a contract to repair the bridge and maintain it and recover the money in 15 years with a contract to sell tickets for going on the bridge. Now, there is no restriction of how many people could go. There is no oversight we can see in the contract. What should be the nature of the repairs? Who would actually check that the integrity of the bridge was being maintained and it had been renovated properly, or to see what should be the load the bridge would carry. None of these things find any mention, and the government also and the municipal authority in this particular case seem to have absolved itself of all responsibility, saying government will have no oversight of anything that the private party does, which is absurd, because this is a public facility that you're giving for running to a private party. It doesn't absolve you as a state or as a municipality of the responsibility for the citizen. And in this case, the government, state government, Gujarat government, as well as the municipal authorities are involved to get the contract, because the river is the responsibility of the state. Any bridge over it is the responsibility of the state so far as safety is concerned. So you cannot treat it as just a commercial contract, but you have to look at these aspects also. None of this seemed to appear to have been looked at this. And I think that's what the people have to raise, and that's what we need answers for.
Right. Right, Prabir, absolutely, especially in a tragedy of this scale. And that's all we have for you today. Thank you for watching Daily Debrief. Do come back to us tomorrow. You can find more such stories on our website, peoplesdispatch.org, and look out for our regular updates on Facebook, Twitter, and Instagram.